Hi guys, welcome back. In this video we shall be talking about the heart failure, right? So we have to understand that we are having the heart on the left side of the chest here, right? The function of the heart is to pump blood, right? So whatever you're able to see in blue structure, in the blue thing, this is actually the vein. This carries the deoxygenated blood, and the red one is carries the oxygenated blood. All your body tissue, from your lower limb, from your head, from your upper limb, from your chest, your abdomen, all that blood that is having less amount of oxygen, that is deoxygenated blood, comes via the vein and then comes to the heart, and then heart sends to the lungs. From the lungs it gets oxygenated, from the lungs it comes to the heart again, and then heart spreads all over the body via this artery. Artery are red in color, veins are blue in color, right? So we are going to talk about heart failure. Please try to understand a human adult is having around 5 liters of blood, right? For an example, all that blood that is present in the body, that is deoxygenated blood, is going to come to the heart, right? And from the heart the blood is going to be pumped out, right? So whatever is coming in and whatever is going out, there is a balance. If whatever is coming in and whatever is going out, there is a difference, it is known as heart failure. Let's say, example, if 5 liters of blood is coming to the heart and the heart is able to pump out 4 liters, so we have a difference of 1 liter, so we are having a heart failure here, right? Heart failure means the heart is pumping but not pumping adequately, right? And what does cardiac arrest mean? Cardiac arrest means the heart is not pumping in the first place. It's not pumping only, right? And myocardial infarction means whatever the muscles of the heart is supplied by the blood vessels, that muscle has been damaged. That is, the coronary arteries have been damaged. Remember, the heart function of the heart is to pump blood, but heart is also a muscle, so it also requires blood. If this blood vessel that is supplying the heart muscle, that is the coronary artery, is affected, then you have something known as heart attack, right? So we are talking about heart failure today, so please don't confuse heart attack, that is heart myocardial infarction, with cardiac arrest and heart failure. Cardiac arrest, there will be no pulsation, there will be, heart will not beat in the first place, right? In cardiac arrest you need to give CPR, right? In myocardial infarction, what is happening, the muscles of your heart has been damaged, but in heart failure, whatever amount of blood is coming to the heart, that same amount of blood is not going out of the heart, right? So let us try to understand with the basic anatomy of the heart what is heart failure, right? So we're going to talk about this. Yeah, okay. Here we are having the inferior vena cava and the superior vena cava, right? The superior vena cava is bringing blood from the from your head, upper chest and upper limb, right? From your hand, your head and your upper chest, that blood is coming. This blood, remember, is not having good amount of oxygen, it is deoxygenated blood. Same thing happens from inferior vena cava, from your lower chest, from your abdomen and your lower limb, that deoxygenated blood is coming to the inferior vena cava and superior vena cava. Both this blood comes and they come in the right atrium here, right? In the right atrium, it will go to the right ventricle, right? Now how it will go, there is a valve here, so this valve is known as tricuspid valve, right? The blood will come here in the right ventricle. Now from the right ventricle it will go to the lungs for the oxygenation process. How it will go? It will go via again a valve. Now this valve is known as pulmonary valve, right? From the pulmonary valve it will go to the pulmonary artery and it will go to the lungs. Please remember, the blood that is flowing in the pulmonary artery is actually deoxygenated blood. Generally we say that all the arteries carries oxygenated blood and veins carries deoxygenated blood. Here is the exception. Now once it goes to the lungs, it will get diffused to the blood. The blood will get diffusion will occur, so the carbon dioxide will be thrown out of the body, and the breathing that you have taken, the oxygen will get entered in the blood, right, in the lungs. From the lungs, now again it will come to the heart, right? It will come from the lungs via the pulmonary vein. Yes, again it's a pulmonary vein. This is carrying oxygenated blood here, right? So from the pulmonary vein it will come to the left atrium, right? This is the left atrium. right? From the left atrium it will go to the left ventricle. Why? Again, there's a valve here. This is known as mitral valve, right? In the left ventricle, it will squeeze and will throw out the blood via the aorta to the entire body surface, right? How it will go? It will go via the aortic valve here, right? So this is what you have to understand. So what is heart failure? The amount of blood that is coming from here, right? All the lungs, and the heart is not able to pump out the adequate amount of blood outside. So that is heart failure. So how do we grade heart failure? That how much amount of heart failure you are having, right? Let's say you are pumping 5 liters of blood and you are able to pump out 4. So there is difference of 1. So how much is actually the difference? So for that we have something known as a New York Heart Association. They have made a classification. So we grade the patient grade 1, 2, 3 and 4. Remember, in grade 1 will have no symptoms. He is perfectly fine. There is no symptoms, right? But in grade 2, what will happen if the person is doing some certain kind of ordinary activities, just he's walking the stairs or just walking here and there, he gets a little bit of breathlessness, he gets a bit of difficulty in breathing, right? In grade 3, what will happen if he is climbing the stairs, he has to actually stop, right? He has to catch his breath, he is not able to walk fast, right? This is grade 3. And grade 4 is the condition is so bad that he is not able to wake up from his bed. He is not able to get out of his bed. Even if getting out of the bed makes him difficult. So that is grade 4, right? So remember, grade 4 the patient will be in the bed. Grade 1 there will be no symptoms there. Grade 1 is perfectly fine, right? Grade 2 and 3 is between. So grade 2 is yes a bit of problem. Grade 3 more problem. Grade 4 severe problem, right? So that is what you have to understand. So now let us try to understand what will be the symptoms. Now what will be the symptoms that the patient is going to have. So remember, so blood that is coming out of the brain, out of the heart, is going to the brain. So less amount of blood is going to the brain. So what will happen? The patient will be confused. He will be not able to think properly. He will be confused. He will be in altered sensorium. He might not be able to say the day, night, time, what is his name, where he is. He'll be speaking something unlogical words. He'll be speaking. And what will be the symptoms in the neck? Please try to understand. Yes, in this, the blood that is going to the aorta is going to the neck also, but there's less amount of blood going to the neck, right? So the neck veins will collapse. But no, due to the back pressure, there is accumulation of your blood here, because whatever blood will come here will go to the left heart and it has to pump. So if it is not going to go out, so there will be pooling of blood. That means the blood will get accumulated into veins. So that's the reason you will see the neck veins will be distended. Right? At the same time, even the lungs, right? Even in the lungs, what will happen? Because the blood is not able to be pumped out of the heart, so what will happen? There will be back pressure from to the left atrium to the pulmonary veins, and there will be leakage in the blood in the lungs. So there will be pleural effusion. So the patient will be having shortness of breath. He might be having cough. All these symptoms will be there in the lungs, right? Now, what will happen in the spleen? What will happen in the spleen? Please try to see this image. One second. Where did it go? Yeah. So you are having the spleen over here, right? You are having the spleen here. Remember, this is the inferior vena cava, right? This is the parts of the inferior vena cava. It is connected to here, right? So there is pooling of blood here. So if there is pooling of blood here, so it will slowly give back pressure to the inferior vena cava, and slowly all this, your mesenteric vein, your portal vein, your hepatic, the splenic vein, your portal vein will get distended. Even your liver will become big, right? Remember, liver has dual blood supply. One blood supply is coming from the aorta. This is very much high in oxygenated. This one is actually having less amount of oxygen but more amount of nutrition for the metabolism here, right? So 75% of your blood supply to the liver is due to portal blood flow, right? That's the reason even if there is heart failure, there is no outgoing of the blood from outside the heart. There is back pressure of the inferior vena cava that is putting pressure here, and the liver will become big. Same thing will happen, the spleen will also become big, right? So these are the things that how you can trace back the backflow, right? Even the intestine will become swollen. There will be maybe ascites. There may be difficulty in absorption of the nutrition, and along again the lower limbs. As I told you again, lower limbs. Why? Because the inferior vena cava is draining the blood that is coming from the lower limbs, lower chest, lower abdomen. So there will be blood accumulation, there will be backflow, and the legs will swell. So if you press the leg, you will be able to see pitting edema, right? So what I want to say is that just make it very simple. Whatever the blood is coming, right, whatever the blood is coming, it has to go and it has to come out of the heart. If it is not going to come out of the heart, it is going to give back pressure to the heart. Just simple that. Just remember, it's going to give back pressure to the heart. So you can trace back. If there's back pressure in the superior vena cava, all the structures that is connected to superior vena cava will be affected. All the structures connected to the inferior vena cava will be affected. I'll show you what are the structures if I connected with the superior vena cava. Superior vena cava, this is your superior vena cava. All your neck veins will be increased. Yeah, that is the reason you are able to see the patient will be having JPV. You are able to see the JPV is raised. You are able to see that the jugular venous pressure is raised. It will be swollen type of neck veins will be seen, right? So this is what you have to understand. Now let us try to understand what is the cause of heart failure. What is the cause of heart failure, right? Just remember, why is the heart failure occurring? Because the blood is not going out of the heart, right? Whatever the blood is coming in the heart, that amount of blood is not going out of the heart. Now what can be the reasons? Remember, this left ventricle, it squeezes and throws out the blood. If the squeezing property goes less, if it is not able to squeeze properly, yes, there will be less blood flow going out, right? If this muscle become weak, obviously there will be heart failure. The nerve that is giving signal to the heart to squeeze, that is not working, yes, there will be heart failure again. If you are having rheumatic heart disease, right, rheumatic heart disease means these valves have been damaged. Remember, if these valves becomes damaged, so whenever the blood is here, from here the blood goes here and it does not allow the blood to go backflow, because whenever the heart squeezes, there is pressure generated here and this blood will go this side. The blood should not go this side. If this rheumatic heart disease, these valves are damaged, they may be leaking here. So whatever the amount of squeezing is done, not all amount of blood is going to the aorta. Some amount is going back also, right? Or sometimes there can be, in rheumatic heart disease, there can be stenosis here. Stenosis means this valves will become very stiff. So whatever the blood is coming, not good amount of blood can go to the ventricle, right? Another very important cause of this is if you are having shock, that means there is no blood in the system only. If there is no blood in the system, right, you are bleeding to a very great extent. So there is no blood coming here, it's coming to here, again coming here. If there is no blood here, what will the left ventricle pump out? It cannot pump out, right? Along with this, you have to see if there is ischemic heart disease, right? Ischemic heart disease means, wait a second. Yeah, this is your coronary artery disease, right? Not ischemic heart disease, sorry. Coronary heart disease, remember, as I told you, this heart is made up of muscle. This muscle actually requires blood to survive. Now, if the blood supply to this coronary arteries have been damaged to this muscle of the heart, yes, you will be having heart failures, right? So remember, what will be the treatment in heart failure? Main treatment of heart failure, we have to try to find out the cause. Why is the patient having heart failure? If there's rheumatic heart fever, treat the valves, right? If these muscles are not working, give some muscles medicines that makes the contractibility of the heart stronger. If nerves are not working, correct that. If there's shock, give more fluids, right? And remember, whenever there is less amount of blood going to the entire body, less amount of blood is going to the kidney also. Kidney has a very important system. Whenever less amount of blood goes to the kidney, it thinks that the body is in shock, there is bleeding somewhere. So it will start an action that is known as RAAS, renin angiotensin system, right? So what it will do is that it will start to absorb sodium. So whenever it is starting to absorb the sodium, it will absorb water, so the blood pressure will increase. So in this case, we have to give ACE inhibitors, and also, as I told you, there will be edema in the legs, we will be giving diuretics. So this was about the basic treatment of the heart failure. Lot of exercise, reduce the stress, reduce salt intake, and ACE inhibitors and diuretics, and sometimes gene therapy. That's all for now. Thank you.